so mad because I recorded a video and somehow I got the pausing mixed up, and I literally recorded a whole video of me pausing and thinking between shots. Anyway, I'm laughing because this is so true. So for so many of us, reconnecting to our bodies can be extremely painful and even traumatizing or traumatic. So it's really difficult to reconnect to our bodies because it can cause us pain, it can bring up bad memories. There's a lot tied to it. So there's a lot that you need to do to heal that connection. But what I'm going to share with you are the things that I know that work. It's called biofeedback. If you want to look it up, I'll also tag a creator who talks about it, who does a better job explaining the actual process. But essentially, you want to reconnect the sensations using your hands in a mirror, in front of a mirror, and reconnect the sensations of what you're feeling when you touch yourself in a safe and, non-painful manner. And so that your brain can see like, oh, this is what this muscle is doing, moving it around, making, contracting the muscle or whatever it is that you're trying to do to re-engage the connection between your mind and what you're sensing with your body. Again, you have to do something that is going to feel safe and comfortable for you. Don't ever do anything that's going to cause pain. But be aware that this can bring up emotions and things that you weren't aware of or don't remember. The best thing that you can do is work with a therapist, especially if your therapist is neurodivergent. Like, I don't feel any neurodivergent person should have a therapist that isn't also neurodivergent. And honestly, I think about that with the same with like medical professionals or anybody who's going to help you with your quality of life. Read about the double empathy problem if you have questions about that. But good people that you can go to for this, of course, there's a ton of stuff online, but physical therapists that specialize in hypermobility, occupational therapists that specialize in neurodivergency or autistic adults. And although I don't have Facebook and despise it, Facebook groups are a great place to find people in your local area who are recommending people who are good. So like for me specifically, I have Ehlers-Danlos syndrome, which is a connective tissue syndrome. It affects every single part of my body. People with Ehlers-Danlos have, you can have different symptoms and different things happening. And it's so varied that every individual Ehlers-Danlos patient has a very unique set of scenarios and experiences, but we have a lot of things in common and a lot of similar traits and symptoms. All that to say is that we have chronic pain for various different reasons. And doctors are taught to not learn about Ehlers-Danlos because it is so rare. It's definitely not rare. It's just extremely underdiagnosed. And a lot of people can go most of their lives without realizing they have it because some people have a mild presentation, but it still means that they have a lower quality of life, especially if they don't take care of themselves when they're younger and then they get older and then they just chalk it up to aging. So reconnecting can be painful, but it absolutely is worth it.